Hello, I'm Patrick Gerard, Director of Advocacy with the International Companion Animal Management Coalition, known as ICAM, and I'm delighted to be here with you today. ICAM brings together 9 of the world's leading animal welfare NGOs, and together we work to change how communities manage free-roaming dogs and cats. Our vision is simple: communities where animals and people thrive together. And to get there, we need dog and cat friendly towns and cities. Well, as many of you will know, more and more of the world's population is living in cities. Over half of the world's human population already live in cities, and by 2050, that figure is expected to rise to more than two-thirds. So, as urban populations grow, the challenges linked to free roaming dogs and cats grow with them. Where people go, companion animals, dogs and cats follow. They're all domesticated, including those born on the street, and they rely on people for food, care, and company. Right now, 59% of all dogs, so 6 in 10, and 3/3 of all cats, so 75%, are free roaming, living on the streets of our towns and cities. But while free roaming dogs and cats are common in cities worldwide, the issue is often overlooked in public debate, particularly at the national level. And that's a problem because unmanaged populations affect animal welfare, people's quality of life, and the health of a city as a whole. So that's why ICAM commissioned the research I'm about to speak about today. Before I get into the data, I'd like to share some definitions with you. When we say free roaming, we mean any unsupervised dog or cat, whether owned, street born, lost, or abandoned. They're often called strays or street dogs and cats. By population control, we mean strategies that target the symptoms, so the dogs and cats on the street now, rather than the causes that put them there. Culling is a population control method based on mass killing, often indiscriminate and carried out on the streets. And for example, this can include poisoning or shooting dogs and cats. CNVR stands for catching, neutering, vaccinating, and returning free roaming dogs and cats to where they were found. For clarity, we neuter so they can't have puppies or kittens or nuisance breeding behaviour. And lastly, humane population management. And now that is an approach that tackles the root causes of animals living on the street. CNVR forms the backbone most commonly, and it's supported by community engagement, owner education, policy and regulation, and accessible veterinary care. Now, a word on the research itself. The data comes from a survey of 2,409 urban residents across Mexico, Turkey, and the Philippines, run in late 2025 by Flood and Partners. So that's roughly 800 respondents in each country. Now, Flood recruited participants through online panels designed to be nationally representative on age, sex, and education. Respondents were also screened to confirm they lived in urban communities where free roaming dogs and cats were prevalent. Some of our participants saw only weekly or monthly dogs and cats on the streets, but most saw them far more often. 62% told us they saw free roaming dogs every day, and 68% saw cats every day. So for the majority, this is a daily feature of urban life. The platform also let respondents expand on their answers in their own words, so the data carries qualitative texture as well as percentages. Now, the survey covered a lot of ground, but today I'll cover what experiences people have with free roaming dogs and cats, how they perceive them, what they think should be done, and whether they'd pay for it through local taxis. One design choice worth flagging, so geographical spread. We chose 3 countries on 3 continents to see which views held and which shifted across diverse cultures and geographies. 3 countries isn't a global sample. Even so, the consistent results across these 3 culturally distinct places strengthen our hypothesis that the patterns are likely to hold in similar urban contexts elsewhere. So let's start with where free roaming dogs and cats come from. So 3/4 of people, 74%, agree that some of the free roaming dogs on their street were abandoned by their owner. For cats, it's 69%. The public see a connection between owner behaviour and the animals on the street. We also asked how people feel about the free roaming dogs and cats on their street. We asked whether seeing them hungry, sick, or injured made them feel sad. Nearly 9 in 10 said yes for both dogs and cats. We asked whether they should be treated with kindness, so whether the dogs and cats on the street should be treated with kindness. And again, nearly 9 in 10 agreed. These figures are almost identical for dogs and cats. The open text response reinforces this. So people described feeling sorry for animals in the street, upset by visible neglect, and troubled that no one seemed to be taking responsibility. But there's another side to this coin. Around 6 in 10 people also agreed that free roaming dogs transmit rabies and other diseases, while 73% told us they've seen a dog rummaging and spreading garbage, and 62% had seen a dog involved in a traffic accident or near miss. So concern about risk to people is there too, alongside the compassion to animals. What are the policy implications? Well, the public connects free roaming populations to human behaviour, particularly to abandonment. That points policy upstream towards affordable, accessible vet services, but also rehoming routes, better support for prospective owners, and regulation of breeding, all the things that reduce abandonment in the first place. Public unease about free roaming dogs and cats isn't a single thing, it's 2 things sitting alongside each other. On one side, concern about the animals themselves. People don't like seeing suffering on their streets. They feel for them and they want something done about it. On the other side, concern about the impact on people, mess, noise, the risk of bites, the fear of disease. Those concerns are real. Now, the risk is that policymakers and city leaders hear public concern and they only account for the nuisance behaviour, not the harm to people when they witness an animal suffering on the streets. Consequently, city leaders can reach for the response that looks simplest to deliver, and that often means culling. But culling doesn't address what the data shows. It keeps people seeing the suffering they're telling us they don't want to witness. It works against the grain of public feeling. Humane population management works with public feeling rather than against it, addresses both sides of public concern at once. So we've looked at the emotions people feel when they see free roaming dogs and cats. Now we're going to look at how they perceive the lives of street dogs and cats. Starting on the left, around 31% describe free roaming dogs' lives as very poor. For cats, it's 20%. Then poor, and the gap holds, 36% for dogs, 29% for cats. Then we get to okay and mostly good, and here the pattern flips. Cats are more likely than dogs to be seen as doing all right. The net figure on the right tells the whole story. 2/3 of people, so 67%, describe dogs' lives as poor or very poor. For cats, it's just under half, 49%. That's a big gap. The public see free roaming dogs as worse off than free roaming cats. So why? Well, the qualitative data gives us part of the answer. Cats are more widely accepted as part of the community. They're seen as useful, with 3/4 of people saying that they help control pests. And they're seen as calmer, more independent, and less threatening. People talk about dogs differently. The words that come up for dogs are fear, aggression, packs, attacks, bites, and risks to children. So when people look at a free roaming dog, they see an animal whose life is hard, and they also see a potential threat. When they look at a free roaming cat, they see an animal whose life might be hard, but they're more likely to see a neighbour. the policy implications questions. What do these differences in public perception mean for how we go about humane population management? Well, firstly, the technical work is the technical work. CNVR, education, accessible veterinary services. What changes is the community engagement around it, because the public bring different concerns and different feelings and different starting points to dogs and cats. And of course, that shapes how programs get designed. For cats, communities mostly start from acceptance. Cats are seen as part of the neighbourhood, often useful, rarely threatening. So the conversation is mostly about welfare and numbers, why we trap, why we neuter, and why we return. For dogs, communities often start from fear. Now, this is real fear about bites, about children, about packs. So the conversation must do more. You have to take those fears seriously and bring along the communities that are afraid of the animals on the street, not just the communities that want to help. So it's the same technical work, but two very different conversations on the ground. The next slide gets to the heart, not just of what the public actually wants, but what they're willing to pay for. So we asked people whether they would support their local taxis being used for specific interventions. The results point in two clear directions: approval for humane approaches and rejection for culling. So vaccination is at the top, then owner education, so helping people become responsible owners, then sterilisation. All three have almost universal support for both dogs and cats. Taken to a shelter, above 80% support for dogs and cats. Microchipping, 72% for both. Then we have a step down, so euthanasia to prevent suffering when it's the kindest thing to do, just under half for both dogs and cats, so people are more cautious here. And then the last bar, a significant drop again, killing healthy animals to control numbers, 9% for dogs, 7% for cats. So look at the shape of that. The components of humane population management, vaccination, education, sterilisation are all at the top, with near universal support for tax funding. Culling is at the bottom, with support in single digits. So what follows from this? Well, firstly, governments have public permission to fund vaccination, sterilisation, and owner education. The public is telling us that they want their tax money spent here. That changes the political conversation. The argument that we often hear from policymakers and city leaders that we can't afford this has to be weighed against the data showing people are willing to pay for it. Humane population management should be treated as a mainstream local services. The public backing is there. And the reverse holds too. Public money spent on culling lacks democratic legitimacy. Culling lacks public consent, not narrowly, not in some countries, not for one species, overwhelmingly, consistently across 3 countries for dogs and for cats. Governments that fund culling are going against clear public opinion. That's a democratic problem as much as a welfare problem. So you might be thinking, this sounds interesting, but how do we know CNVR works in practice? Does public opinion shift when a city commits to humane population management? Well, my colleague, Dr. Elly Hiby, the director of the ICAM Coalition, is going to share data from Bangkok that speaks directly to those questions. So over to you, Elly.
Thank you, Patrick. In the second half of our presentation, I'd like to share an example of an active humane DPM project in Bangkok, Thailand, and what the citizens of this city told us about the livability of a city with dogs on the street and how that changed over time with this intervention in place. The Greater Bangkok metropolis is home to 17 million people, spanning 6 provinces and including a range of housing from highly developed high-rise city centres to really quite rural settings where they have both arable crops and livestock, including fish farming. And throughout the entire region, they have a lot of stray dogs. 10 years ago, there was an average of just under 3 dogs for every kilometre of street. So on a typical 5-kilometre commute to work or to school, you would expect to be passing about 15 dogs on every journey. In 2016, 2 NGOs, Soy Dog Foundation, a Thai NGO, and Dogs Trust from the UK, launched a project, a CMVR project, where they caught, neutered and vaccinated stray dogs before returning them to the point of capture. They also provided free sterilisation services for owned dogs. They use mobile clinics that they pop up in temples and community centres. They use a systematic approach to coverage. They conduct CMVR of all the roaming dogs they can access within a district, ensuring they've exceeded 80% coverage before moving on to the next district, and then returning to the same area on a 1 to 2 year cycle to top up the coverage back above 80%, each time requiring fewer sterilisations to reach 80%. This strategy can be termed front-loading. The first year is really hard work to get up to coverage, while subsequent years are maintenance. And this is a more cost efficient in terms of population impact than spreading sterilisations evenly across time. And just to give you an idea of the scale of this intervention, by the end of last year, they had sterilised over 700,000 dogs using a fleet of 10 mobile clinics. Their annual street count of stray dogs along the 20 transects shown in the blue lines here have revealed a steady decrease in dog density over time. You can see in the left-hand graph that there was a consistent fall in density across all the transects. And when we look at the average dogs per kilometre of street, we can see this has shown a very significant decline overall, about a 10% decline in stray dog density for each year of effort, and after 7 years the density had more than halved. And because CMVR includes vaccination, this builds up herd immunity to rabies in the stray dog population. And this herd immunity is supported by sterilisation because this prevents the birth of immune-naive stray puppies that would otherwise reduce herd immunity. Local government also run vaccination campaigns of owned dogs, many of which are allowed to roam, and together this has led to a decline in dog rabies cases across the Greater Bangkok area, as we can see in the blue line in this graph, and the orange bars represent the CMVR effort per month. Now, a street survey and dog rabies surveillance will tell you whether there is a statistically significant decline in numbers, but actually what we want to know is whether this reduction is meaningful for citizens. And so SoyDog ran a household questionnaire where they approached a stratified or random sample of just over 3,000 households. And you can see in this map, the dark green areas are where their CMVR efforts have been through several cycles of effort, and the white regions are sub-districts that they had not yet reached at the time of the questionnaire, so these act as control areas. The dots are respondents, yellow are dog owners, and black dots are non-dog owners. And this questionnaire asked a range of questions, both about dog ownership practices and the respondents' perception and experience of free-roaming dogs. Lots of interesting findings shared in the publication listed on the slide, and I'm going to share just a few of those here. The first question asked citizens for their perception of how the numbers of stray dogs had changed in their neighbourhood, and this was asked over 2 time periods. They were asked whether there had been a change over the last year, and how does the number on your street today compare to the period of time before the intervention started, and we used a memorable event to landmark that point in time. And both approaches basically delivered the same response. In the bottom bars, these are people living in areas that had not yet received CMVR. They were more likely to say that the numbers had increased in the past year. And thinking longer term, they were equally likely to say the numbers were greater today as they were to say that there were fewer. But in the upper bars, these are people living in areas that had benefited from CMVR. They perceive the numbers of dogs to be fewer, and this is a dose-dependent effect. The more CMVR rounds the neighbourhood had received, so going further up the graph, the more likely the resident was to say that the number of dogs had diminished, which we can see by the increasing length of the green bars. So the decline in stray dogs was not just numerical, it was a meaningful and noticeable reduction. The policy point to draw on here is that although the decline in dog numbers was gradual, a fall of over half over 7 years, citizens did notice this change. I've heard it argued that biology moves slower than politics. CMVR relies on natural attrition, the lack of puppies to replace those dogs that have died. And some politicians may have much shorter time spans in mind than the life of a stray dog, but citizens have the patience to notice these steady changes. And also, the longer you invest in DPM, the greater the reward. There are compound benefits to persistent efforts. The questionnaire also asked for people's experiences of living with dogs on their streets. Were they ever troubled by nuisance behaviours, or were they ever concerned for the welfare of dogs? 14% said they had been troubled in just the last month. And again, there was a question that used this same landmark event to ask people to compare their experience with stray dogs today as to compared to before the intervention had started. Again, in the bottom bar, we see the responses of people living in areas that had not yet received CMVR, and they were equally likely to say the problems were greater today as they were to say that there were fewer. But in the upper bars, we see more people perceive the problems to have diminished. Again, we see that dose-dependent effect. The more CMVR rounds, higher up the graph you go, the neighbourhood had received, the more likely the citizens were to say that their problems with dogs had diminished. So we see those green bars increasing as you go up the graph. Now, despite the fact that people were still experiencing trouble with stray dogs, the attitude of citizens to dogs in Bangkok is generally very tolerant. When we asked people how they felt about the number of stray dogs in their neighbourhood, most people were neutral, the grey bar, but many accepted this number, and some were even happy, those are the green bars. There were relatively few that had a problem with the number of strays, which is shown in the orange and red bars. And when we asked for their preference for managing these dogs, sterilisation was the overwhelming choice, as we had in the citizens' poll that Patrick has just described. And none of the respondents said that they would prefer culling as the way of managing those dogs. So in terms of policy implications, even when people note there are concerns with stray dogs, and they may well still report this to their city leadership and mention it as an election issue, they can still show tolerance and willingness to share their streets with dogs, especially if they're being managed in a way that they consider to be humane and effectively minimises nuisance. So there's also a behavioural benefit of management through sterilisation. So although its impact on numbers is not immediate, you're waiting for natural attrition to take place, a population of sterilised dogs are immediately much easier to coexist with because many nuisance behaviours are actually connected to breeding. So just in summary, the Greater Bangkok metropolis has been benefiting from a Humane DPM project for the last 10 years, and this has delivered reductions in rabies cases and stray dog numbers. And these benefits are meaningful and noticed by citizens. The Humane DPM solution of CMVR and owned dog sterilisation services fits the preference of Bangkok citizens. They got what they wanted. And as a result, there is now a widespread coexistence with the managed dog population across this city. Thank you for listening. I hope you enjoyed it.